My name is Rubin. I'm a professor of bioengineering here at Stony Brook University and director for the Center for Biotechnology. TAF funded us to develop a technology that uses mechanical or non-drug means to augment proliferation of T cells as a sort of a clever, non-invasive way to reduce vein-to-vein time in autologous cell therapy.
My name is Chris Ashdown. I am a graduate research assistant in the lab of Dr. Clint Rubin here at Stony Brook University. This project is using what we like to call low-intensity vibration. It's a mechanical signal, and our goal is to use this to try to improve immune cell growth and function, specifically to try to improve CAR T manufacturing and therapy. CAR T therapy involves removing a patient's own T cells from their bloodstream, genetically engineering them with a specific receptor that'll target cancer cells, and then reinfusing the patient's own T cells back into their body to fight cancer. One of the main reasons why cancer is so dangerous is that it does a really good job of evading the immune system. So by genetically engineering these T cells, we're able to allow them to find and home in on cancer cells and kill cancer cells that they ordinarily wouldn't be able to see. It's that genetic engineering process that often takes far too long and leaves a lot of patients kind of in the lurch, waiting to receive treatment from anywhere from 10 days to 2 weeks. If we can cut down that manufacturing period by even as little as 3 or 4 days, now we're able to get these cells back into patients sooner. The cancer's had less time to grow in their body, and we should have more efficacious treatment or better outcomes for patients.
What the TAF funding has done is provided us with sort of proof of principle funding to use our own strategy and our own intellectual property to see if this non-invasive mechanical strategy works to accelerate proliferation of T cells. The impact is to leverage the wonderful therapeutic of CAR T and make it available sooner for more people. What inspires me are not only the students I have the privilege of working with, but the thought of taking the work that we're doing right here at the benchtop and see it translate to the clinic to help patients. And what I've learned is that you have to, at some point, to translate from bench to bedside, you have to involve the commercial sector. So I think what keeps me going is the hope that my science helps people.